Pop quiz number 1. The nurse is caring for a child who just returned from surgery for repair of a cleft lip. In which order, from first to last, should the nurse do the following? 1. Maintain clear and adequate airway. 2. Maintain sufficient fluid and caloric intake. 3. Provide emotional comfort to the child. 4. Apply elbow restraints. 5. Teach the parents proper feeding methods. What do you guys think? Okay, so before I tell you what the answer is, whenever you get test questions like this and you have to list things in order from priority, what you're going to do first, always think about physiological integrity. What keeps your patient alive and safe? That's always going to come first. So number 1 is going to be number 1. That patient breathing, because guess what? If that patient doesn't have a patent airway, we don't care about anything else, right? So number 1, maintain a clear and adequate airway. Great. The next thing you're going to do is number 4, apply elbow restraints. And the reason for this, remember, this is an infant. The first thing they're going to want to do is stick their finger or their whole fist in their mouth, and we cannot disturb that surgical site. It'll cause trauma. It'll cause bleeding. We can't have that. So that's the next thing we're going to do after we make sure that the airway is patent. After that, we're going to do number 2, maintain sufficient fluid and caloric intake. Feed the patient. After that, we're going to do number 3, provide emotional comfort to the child. We want to make sure that they're not in pain. And lastly, we're going to provide teaching to the parents. Just so you know, when it comes to trying to figure out what's going to be a priority, your priority hardly is ever going to be teaching or emotional support such as pain if you have other choices that can actually affect the safety or the physiological integrity of your patient. Now, with that being said, there are 3 let me see if I have enough time. Yes, there are 3 situations where pain is a priority. Pain, you're going to treat pain as you would, hemodynamic status, etc. What are those situations? MI. If the patient's exhibiting signs and symptoms of having a myocardial infarction. Next, sickle cell crisis, that type of pain, that is a priority. And the third one, stones, kidney stones, calcium stones. If the patient's having stones, that pain is so severe, it actually can affect the patient's physiological integrity. You know what? I said 3, but there's actually a 4th one, cancer. That type of pain is so harsh and so severe, it needs to be addressed as physiological integrity as well.